Typically when somebody gets to be 100 pounds of their ideal weight, only about 5% of the people can lose that weight and keep it off without some type of help, such as a gastric bypass or a sleeve gastrectomy. So first of all, you tell them they're not alone, because most of these patients are really afraid of failing. And every diet they've tried, everything they've done for the last probably 20, 30 years, they've failed at. But that's not, I think it's important to let them know they're not alone. But I think the people that we see typically, they were heavy as third graders, they were heavy as teenagers, they're going to be heavy the rest of their life until they do something like a gastric bypass or a sleeve gastrectomy. If they can lose their weight without any surgical procedure, I tell them that's the safest way to go. But most people have exhausted multiple different diet attempts and have failed. So it really can affect a lot of their emotional state, but also from a health standpoint, everything you can think about it, whether it's orthopedic injuries, knee replacements, hip replacements, those are much more prevalent in people that are 100 pounds over their ideal weight. Cardiac disease, reflux, breast cancers, colon cancers. There are a lot of things that are affected with people that are overweight. So being able to help those people get down to a manageable weight and a safer weight really does decrease their health risks. A lot of times, like the diabetic medications, they'll come on either oral hypoglycemic or diabetic pills or insulin. And typically we will take those folks off the medications right away. So the guidelines are basically folks that are BMI of 40 or higher with no what they call comorbidities or diseases or issues related to their weight. And that translates to basically 100 pounds over being your ideal weight, or a BMI of 35, which is around 60 to 70 pounds over your ideal weight, with a significant comorbidity like uncontrolled hypertension or diabetes. So if folks are having issues at even a lower weight, the insurance companies will a lot of times cover them. So that comes from, there's old charts probably 30, 40 years ago where once you're 100 pounds over your ideal weight, the risk of you having any health issue because your weight goes up exponentially. So there are really only two main surgical procedures we do right now. So the sleeve gastrectomy and the Roux-en-Y or RNY gastric bypass, those are both the same procedures. So the gastric bypass patients, some patients may have uncontrolled diabetes, may have a little better effects with the gastric bypass because it has better sugar control with that, or insulin effects with the gastric bypass. Sleeve gastrectomy is the most popular procedure that we do, as well as the most popular across the country, mainly because it's a quicker recovery and a little bit easier recovery on the patients, and they lose close to but not quite as much weight as the gastric bypass. There's a new procedure which I'm doing as well, which is a non-surgical procedure, which is an endoscopically placed balloon. So basically it's about a 600 cc or softball-sized balloon that we fill up with saline or salt water, and that stays inside the stomach for about 6 months. Just makes people feel full more quickly, and so it decreases how much you can eat in any one given meal. And typically people lose about 30 to 40% of excess weight with that. Well, at the end of the day, no matter how good the surgeon is or which surgery anybody does, if people don't make some conscious efforts to change their lifestyle, you can regain a lot, if not all, your weight. So most people will lose a lot of weight early on with the sleeve or the bypass, but if they don't make lifelong changes as far as eating better food choices or smaller portions, or both of those things, they're going to regain a lot of their weight. Both early concerns and late concerns, there's probably a little bit more risk with the gastric bypass, even though it's still a very safe procedure. So early on we make basically two connections, so small bowel to small bowel and small bowel to stomach with the gastric bypass. So you always worry if those staples would come apart or have a disruption or a leak. That's probably the most feared early on complication. You can have the gamut of any other surgical, post-surgical complication, bleeding, infection. Typically though, the most patients that we do is for a sleeve gastrectomy patient. They'll come in the hospital, it takes about 30 minutes. Usually they'll go home the next day or the following day. The gastric bypass patients, that procedure takes about an hour, and they usually go home on post-op day number 2 or day 3. Then we also talk to them about long-term complications, so they need to take vitamins and eat a healthy diet, so they really have to follow the recommended what to eat and how to eat. So early on they could overeat and potentially cause staple line disruption if they don't follow the recommendations at all. That's not ever happened in my experience, but in the literature there's been instances of that. Long term with the gastric bypass too, they're a little bit more prevalent to a small bowel obstruction, because we do work on the small bowel. Small bowel obstructions, non-healing ulcers where the stomach to small bowel connection is. Most of those things don't happen if they follow kind of the recommendations that we use. The sleeve gastrectomy has a much less risky or a much less risk profile early on as well as late, because we're basically just taking out a portion of the stomach. So once that staple line is healed, then the risk of having problems down the road is very small.